Have you ever opened your eyes in the morning, tried to sit up, and suddenly felt that sharp stiffness in your lower back, as if your body had aged overnight? You went to bed feeling fine, but somehow you woke up sore, tight, and aching. For many seniors, that first step out of bed isn't the beginning of a fresh day. It's the beginning of pain. So what's really happening during the night? Why does your back hurt after a long period of rest, when it should be recovering? The answer lies deep within your spine, your joints, and even your sleeping habits. I'm Dr. Evelyn Carter, and in my 30 years of working with older adults, I've seen this pattern over and over again. Most people think it's just age, but the truth is, it's not just age. It's how your body is silently reacting to small things you do every night without realizing it. When we sleep, the muscles that support our spine finally get a chance to rest. But as we lie still for hours, blood circulation slows, joint fluid thickens, and the soft discs between our vertebrae, which act as cushions, absorb fluid and expand slightly. This process is normal, but in aging spines, those discs lose elasticity. They can't handle the pressure changes that come when you sit or stand up again in the morning. The result? That familiar, painful stiffness you feel before you've even had your first cup of coffee. In younger years, your body naturally repairs these tissues overnight, but after the age of 60, those recovery systems slow down. Collagen production decreases, inflammation rises, and hormones like cortisol, which help reduce swelling, drop during the night. So when the morning comes, your joints are inflamed, your muscles are tight, and every little movement sends a signal of pain. I've seen patients who thought their mattress was fine, their sleeping posture harmless, or their pain simply a part of growing older. But once we made a few small changes, adjusting their sleeping position, replacing an old mattress, and introducing light morning stretches, their pain nearly disappeared. It wasn't magic, it was understanding how the spine truly works with age. Pain, especially morning back pain, isn't your body punishing you. It's communication. It's your spine whispering, "I need care, I need movement, I need balance again." The good news is, when you listen, your body responds beautifully. So, if you often wake up feeling sore or stiff, don't ignore it. Don't accept it as something you just have to live with. In the next part, we'll uncover the real causes behind this morning back pain, from the way you sleep, to what happens inside your spine overnight, to how stress and simple habits may be keeping you in pain without you even knowing it. Because once you understand the truth, you can start waking up not to pain, but to freedom and strength again. Most people think pain appears suddenly, that one wrong move or one bad night's sleep is to blame. But in truth, back pain that greets you every morning doesn't start overnight. It's built quietly, little by little, from years of habits, small neglects, and the natural wear of time. So let's break it down together, simply, clearly, and gently, like I've explained to my patients for decades. 1. The posture problem. How the way you sleep affects your spine. When you lie down at night, your body enters a position of trust. It believes you're giving it a chance to rest and recover. But if your posture is wrong, that rest becomes an 8-hour strain. Sleeping on your stomach, for example, might seem comfortable at first, but it forces your lower back into a deep curve all night long. The spine isn't designed to bend that way for hours. The discs between your vertebrae get squeezed, and the surrounding muscles tighten to protect you. By morning, they've been in a silent battle all night. Even sleeping on your back with a pillow that's too high can create trouble. It tilts your neck forward, misaligns your spine, and adds stress to your lower back. What helps? Try sleeping on your side with a soft pillow between your knees. This keeps your spine in a neutral line from neck to tailbone. If you prefer lying on your back, place a small pillow under your knees. This simple trick relieves pressure from your lower spine. I've seen seniors who spent thousands on pain medication, yet found relief only after fixing their posture in bed. Sometimes healing begins with the smallest adjustments. 2. The mattress and pillow mistake, when comfort becomes the enemy. I often tell my patients, Your mattress can be your medicine, or your worst enemy. A mattress that's too soft lets your hips and shoulders sink in, bending your spine into a U shape. Too firm, and it forces your body to stay rigid, cutting off circulation to your joints and muscles. Many seniors sleep on mattresses that are 10 or even 15 years old, long past their supportive lifespan. Over time, foam loses its shape, springs weaken, and your spine bears the burden. Scientific insight. According to the American Sleep Foundation, the ideal mattress for back health is medium firm. It supports the natural curves of your body while still offering cushioning comfort. If replacing your mattress isn't possible right now, try adding a firm topper. Or flipping the mattress if it's double-sided. Replace old, over-fluffed pillows that push your neck too high. And remember, good sleep doesn't start when you close your eyes. It starts with what you choose to lie on every night. 3. The weak core. Why lack of movement leads to morning pain. One of the most overlooked causes of morning back pain is simply weak muscles. As we age, we naturally lose muscle mass, especially in the core, the group of muscles that support your spine. When those muscles weaken, your spine loses its brace. During the night, the back muscles work harder to hold everything in place, even in sleep. They stay tense, and that tension shows up as stiffness when you wake up. What helps? Gentle, consistent movement. You don't need heavy exercise, just small, regular actions that keep your back flexible and strong. Try light yoga stretches, walking 20 minutes daily, or gentle swimming. Focus on movements that open your hips, strengthen your abdomen, and lengthen your spine. A patient of mine, 74 years old, had severe morning pain for years. She thought she was too old to exercise. After just 3 weeks of daily 10-minute stretching and short walks, she told me, "I can finally stand up straight when I get out of bed." The body, even at 70 or 80, still responds beautifully to gentle movement. It just needs consistency, not intensity. 4. Degenerative changes, the silent wear of time. Our spines are incredible structures, flexible, strong, and resilient. But like all parts of the body, they age. Over time, the discs between the vertebrae lose water and become thinner. The cushioning decreases, and bones begin to rub more closely together. This process is called degenerative disc disease, and it's one of the most common causes of morning back pain in seniors. You might notice that your pain is worse when you first wake up, but improves as you move around. That's because motion warms up the joints and increases fluid circulation, reducing stiffness. For others, arthritis in the spine, known as spondylosis, can cause inflammation around the joints and nerves. When you rest overnight, inflammation builds up. When you get up, it flares. How to manage it naturally. Keep a warm compress near your bed and apply it to your lower back for 10 to 15 minutes each morning. Practice gentle pelvic tilts or knee to chest stretches in bed before standing up. Eat anti-inflammatory foods: salmon, walnuts, spinach, turmeric, and olive oil. Stay hydrated. Discs are made of about 80% water, and dehydration makes them stiffer. Remember, aging doesn't mean you must accept pain. It means you must adapt, wisely and kindly. 5. Stress, sleep quality, and emotional health. Back pain is not just physical, it's deeply emotional. Stress causes muscles to tighten and the body to stay on alert. When you go to bed anxious or overthinking, your nervous system remains active. Your muscles, especially in the back and neck, never fully relax. This is why so many people wake up with tension and soreness even after 8 hours of sleep. It wasn't restorative sleep, it was survival sleep. What helps? Create a calming bedtime ritual. Soft music, dim light, or deep breathing. Avoid screens at least 30 minutes before bed. Practice slow, rhythmic breathing. Inhale through your nose for 4 seconds. Exhale through your mouth for 6. Reflect on gratitude or simple thoughts that relax your mind. Science confirms it. Deep relaxation before sleep reduces cortisol levels and lowers muscle tension, leading to fewer pain episodes in the morning. Your back pain might not only be in your spine, it might be in your mind's inability to rest. Treat both, and you'll heal faster. 6. When morning pain means something more serious. While most back pain in seniors is mechanical or lifestyle-related, some cases signal deeper problems. Pay attention if you experience pain that radiates down the leg or causes numbness, pain that worsens despite rest or painkillers, unexplained weight loss or fever, difficulty controlling bowel or bladder function. These could indicate nerve compression, spinal stenosis, or even underlying conditions that need medical evaluation. Never ignore pain that changes character. Your body's messages evolve for a reason. 7. Simple, daily habits to keep your back strong. Let's move from knowledge to action, because healing begins in daily life. Morning routine, 5 to 10 minutes. 1. Before getting out of bed, hug your knees to your chest gently 3 times. 2. Roll your ankles and stretch your arms overhead. 3. Sit up slowly, breathe deeply, and rotate your shoulders. 4. Once standing, march in place or walk around the room to boost circulation. During the day, keep good posture. Imagine a string pulling your head gently upward. Avoid sitting for more than 30 to 40 minutes at a time. Stand, stretch, or take a few steps. Use a lumbar pillow when sitting on chairs. Keep your feet flat on the floor and your knees at hip level. Before bed, stretch lightly or use a warm towel on your back for 10 minutes. Avoid heavy meals and caffeine at night. Go to bed and wake up at the same time each day to balance your body's rhythm. It may sound simple, but these habits create powerful change. Over time, they retrain your body to support itself naturally without relying on pills or constant medical care. 8. Real-life stories of hope. I remember one of my patients, Mr. John, 69 years old. He used to say, "Doctor, I hate mornings. I feel like an old tree that can't bend." We worked together, not with drugs, but with small habits. He replaced his 12-year-old mattress, did gentle morning stretches, and started walking every day after breakfast. 2 months later, he told me, "I still wake up at 6 a.m., but now I look forward to it. I feel light. I feel alive." That's the transformation I want for everyone watching today. 9. Nutrition. Feeding your spine from the inside. Healthy bones and discs don't just rely on posture and exercise. They need proper nutrition. Key nutrients for a strong back. Calcium, for bone density, found in milk, yogurt, kale, almonds. Vitamin D helps your body absorb calcium from sunlight and fatty fish. Omega-3 fatty acids reduce inflammation, salmon, chia seeds, flaxseed oil. Magnesium relaxes muscles and nerves, avocado, spinach, pumpkin seeds. Collagen and protein rebuild tissues, bone broth, eggs, tofu. Avoid excessive sugar, alcohol, and processed foods. They increase inflammation and weaken bones over time. When you eat right, your body has the tools it needs to heal itself from the inside out. 10. Mindset. Healing starts with belief. Pain changes more than your body. It changes your mindset. Many seniors start to believe they're fragile, broken, or too old to improve. But the truth is, healing begins with how you see yourself. When you believe pain is permanent, you stop trying. But when you treat pain as communication, a signal that something needs care, you reclaim your power. Your body is incredibly intelligent. It adapts, heals, and strengthens when given attention, movement, and patience. As I always tell my patients, your back doesn't need perfection. It needs partnership. Final thoughts for this section. Morning. Back pain is not a life sentence. It's a gentle reminder, a whisper from your spine saying, "Please move me, nourish me, and let me rest in the right way." In Part 3, we'll bring everything together. How to build a daily healing routine, retrain your body to wake up without pain, and rediscover what it feels like to greet the morning with comfort, balance, and peace again. Because a pain-free morning isn't just a dream. It's something you can create, one mindful night, one careful movement, and one small choice at a time. As the sun rises each day, your body rises with it, carrying every memory, every movement, and every story it has lived. But if you wake up every morning with pain, you know it can feel like the world starts before you're ready for it. That first ache, that stiffness, can quietly steal your energy, your mood, and your confidence. I want you to know something important today. You are not broken. Your pain is not a punishment. It's a message. Your body's gentle way of saying, I still need you to take care of me. For decades, I've listened to patients tell me, Dr. Carter, I thought this pain was just part of getting older. But the truth is, it doesn't have to be. You can live with strength, flexibility, and comfort, even in your 70s, 80s, or beyond. All it takes is awareness, compassion, and small daily choices. Think about what we've explored together today. How your sleeping posture can either heal or harm your spine. How the right mattress can become your nightly medicine. How a few minutes of gentle stretching can restore what years of sitting have taken away. How peace of mind, not just strong muscles, keeps your back healthy. When you combine these small actions, you send your body a message. I'm listening, I care, I'm ready to heal. And the body responds, always. Even after years of neglect or chronic pain, it can adapt, rebuild, and find balance again. You've seen the proof. People your age waking up without pain for the first time in years, simply because they changed how they moved, how they rested, and how they thought about their bodies. Every morning is a chance to start fresh. Before you rush out of bed, take a deep breath. Feel the air fill your lungs, the stretch in your spine, the quiet gratitude that you are still here, still moving, still capable. See, healing doesn't happen overnight. It happens in moments like this, when you decide to treat your body as a friend, not an enemy. So tonight, when you lie down, remember, your bed is not just a place to rest. It's where recovery begins. And tomorrow, when you open your eyes, remind yourself, you deserve to wake up without pain. If this message has touched you or helped you understand your body a little better, I invite you to subscribe to the Senior Health Daily channel. Here, we learn together how to move better, live stronger, and age with grace and confidence. Because growing older isn't about giving up, it's about growing wiser with your body. So take that first gentle step toward your healing journey, and may your next morning be lighter, freer, and filled with hope. Thank you for watching, my friends. Stay healthy, stay kind to yourself, and I'll see you in the next video.